Welcome to Dr. Armstrong's office. This office originally belonged to Dr. Robert Armstrong, shown here with his wife. He was a practicing medical doctor in Polk City, Iowa from 1860 to 1905. The Glenn Stanley family donated the office to Living History Farms in 1980, and members of the Polk County Medical Society Auxiliary donated time and money to have it restored. As you can see by the historic print above the cabinet, the office was originally constructed in the front of Armstrong's home. A doctor in a farming community needed only a small office for his practice. Most patients didn't come to the office at all. Instead, house calls were the rule. Doctors were expected to go out to visit their patients at home. Dr. Armstrong himself traveled between 20 to 40 miles to see patients on outlying farms. Doctor's kits, such as the one you see in the glass cabinet, packaged instruments and medicines in boxes or leather bags for safe travel. The carriage house behind the office would keep the doctor's buggy, sleigh, and horses all close at hand. The office really was for receiving the few patients who were willing to come to the doctor. The front room was used for patient examination, and the second room served as storage for medicines, which the doctor often made himself out of convenience. The tools of the trade were few. The leather examining chair made patients comfortable for routine examinations, but also lay flat for serious procedures. The doctor would use a wooden stethoscope to check the heart or listen to your breathing. A pocket watch helped time the pulse. Beyond simple tests, the doctor relied on touch and the patient's symptoms to diagnose disease. Even in 1875, most rural doctors did not understand the idea of germ theory. Knowing little about how to sterilize their tools or hands, infections were very common as a result. In spite of this, doctors treated disease, delivered babies, set bones, and did simple surgeries using ether or chloroform as anesthetics. Small towns rarely could support a regular dentist, so most doctors even pulled teeth. The doctor could use the tooth extractor to pull a bad molar. An office visit for a bad tooth could cost you $1 in 1875. House calls ranged between $2 and $5, or even as high as $15 for the doctor to help deliver a baby. Dr. Armstrong was typical in that he learned medicine by apprenticing in the office of another doctor. There was a medical school in Keokuk, Iowa starting in 1849, but apprenticing offered more practical experience. Often, doctors did some of both before opening their own office. Thank you for visiting the doctor's office. I hope the rest of your day is well.